So we are level 4 nursing in Wesleyan University, Philippines po. And we are going to interview po regarding to our subject transcultural nursing.
What is your name, ma'am?
Kim Grail Andres, RN since 2012. Right now, kaka-deploy ko lang ulit sa Saudi, but I've been to Saudi from 2017 to 2020.
My name is Carl Hernandez. I'm 31 years old. I work in Saudi Arabia, and I'm currently waiting for a deployment in Germany.
Second question po, sir, is can you tell us about your experience po on how to deal with client or patient?
Ang handling kasi ng patient, or the way we handle patients here and abroad, are very different. So, dito sa Pilipinas, most of the time, we rely on the significant others to take care of our patients. In Saudi Arabia, hands-on, all the time, we'll be taking care of our patients. Say, for example, basic morning care, bed bath. Usually, we're used to having our, or the significant others do that because Filipinos tend to shy away from having nurses or healthcare workers to take care or do the morning care for them. So Saudi Arabia, regardless of your nationality, you have to do it to your patient. Except maybe for female patients, because in Saudi Arabia, you cannot, or if you're a male nurse, you cannot handle a female nurse who is a Muslim, or there are times when they would let you handle, pero most of the time they won't, especially if they're Saudi, Egyptians, Sudanese, and all the strictly Muslim countries. Dito sa Pilipinas, the OB ward is a combination of male and female. Doon, all female. Even the NICU, all female staff lang ang pwede mag-handle sa mga patients. Pero when it comes to male clients, both genders can handle them.
Follow-up question.
Sure.
Sir, pwede po bang mag-share kayo? Hindi pala question. Sir, pwede po bang mag-share kayo ng experience niyo, sir, na hindi malilimutan or problems, and how you cope po?
Okay. So doon kasi sa Saudi, I work in the medical and isolation unit. So we handle cases that are usually of communicable diseases or internal medicine patients like diabetes and all this. Siguro one of the struggles I had there was nagkaroon kasi kami ng isang vascular surgeon before, also taking care of, or also specializing with diabetic foot. Supposedly, ang tawag dito, he proposed, the medical director, that the medical nurses or the medical ward should handle the diabetic foot patients or the patients that are not for surgery sa amin. So from having 4 or 5 patients with 2 staff, nagkaroon ng change yun, because he would initially admit or usually admit around 10-12 patients on a daily basis, and they would stay with us for around 4 to 5 weeks. So every day yun, parang dalawang staff lang yun. So nakakapagod kasi every day we have to do wound care, which is initially hindi ko din naman talaga alam kung paano gawin. Hanggang sa tinuruan lang kami kung paano siya gawin. Ang naging problema kasi doon is he's got like diabetic foot, right? So every 6 hours RBS, daily wound care, medications. Ang shift namin nun ay 12 hours. So we get to give around 2 to 3 medications per patient on a shift. At ang mahirap pa kasi doon, maraming comorbidities ang mga patients doon. So hindi na namin alam kung paano i-balance out yung pag-handle sa patients niya versus dun sa patients namin as internist nurses, or sa communicable disease, because we have TB patients also there, which are put in negative pressure rooms. Ang naging solution talaga namin that time was to do it paano ba? In a isang diretsuhan, kasi you have to soak yung gagawa ka ng for pagsusukan mo ng wound niya kasi diabetic foot nga, and most of the feet there are gangrenous or like highly infected. Minsan hindi namin na gagawa ng yung maayos na care. Actually, hindi kami doctors. Doctors are supposedly the one doing that, but unfortunately, since struggle din namin yung kasipagan ng mga doktor at mga residente namin doon, hindi kami nakapag-assess or nakapag-provide ng correct care, kasi imagine doing debridement for these patients na hindi ko naman dapat ginagawa. I'm doing on my own without the proper training. Ang training ko na lang yung hands-on talaga, which is very difficult. So yun yung isa sa mga pinakamahihirap na situations. Another would be being understaffed. As I mentioned before, nag-supervisor ako every Friday night sa Saudi. This is because we don't have enough staff. So imagine the global crisis of having understaffed hospitals. We also experienced that. And dumating kami sa point na nag-start kasi yung pandemic that time. Tapos parang 2 or 3 of our staff are not able to help us or to come to duty because they are quarantined. Tatatlo lang kami na nagpapalit-palit sa duty. 12 hours duty with 10, 12 patients on a shift. And sa dami ng ginagawa mo, dadagdag, of course, you have to wear your PPEs and all that. So that's another thing that is also a struggle for us before. So yun yung pinaka-major na naalala kong struggles before.
Sa in terms naman po sa cultures po ng ibang lahi, sir?
Cultural differences. Say for example, hindi naman, it's a Muslim country per se, pero tapos hindi pa hindi lahat ng panahon, or there are actually exemptions to Islam when it comes to the Sikh. So it's totally different from what you usually would see in movies or in what you would read, I think. Wala namang difference. It's how you handle the patient and how you communicate.
Hirap. Kasi diba mga Pilipino, like ako, alam nililibat yan, matapang ako eh. And minsan, is kailangan mo ding lumugar yung tapang mo sa mga pasyente. Kasi hindi lahat ng pasyente uubra ka. Lalo na pag mga dealing with Arabic patients, hindi sila masyadong sanay na, kumbaga, authoritarian na mga lalaki dito eh. So, kailangan mong pakibagayan yun. Hindi madali. Kasi ibang-iba yung nasa Pilipinas tsaka dyan. Tapos, isa sa mga na-experience ko dito sa naninibago ako sa mga pasyente, no, actually it's not new pala. If you think about it, almost all the patients are the same. Feeling nila lahat sila VIP. Ang pagkakaiba lang is the way na sinasabi nila sa'yo. Kumbaga, nasa foreign country ka, hindi mo masyadong maintindihan yung sasabihin nila, so magmumukha kang tanga. Alam mo yon, parang nakikipag-usap ka, may sinasabi na siya sa'yo na hindi maganda, hindi mo maintindihan. So yun, mahirap yung part na yun.
Ma'am, paano po, ano pong strategies yung ginagawa niyo po kapag na-experience niyo po yung mga ganong bagay? Ano po yung ginagawa niyo?
Kung matatakot ka, magsusumbong ka kasi gano'n yung ginagawa ko eh. Noong una, syempre niiyak ka niyan kasi sisigawan ka, tapos kinakausap ka sa lengguwahe na hindi mo naintindihan until you learn how to deal with it. deal with it in a way na matututo ka na din kung paano sila sagutin, kung paano i-handle yung temper tantrums nila, lalo na mga Arabo, hindi yan marunong mag-antay. So yan, you have to present reality kasi dito may mga appointments yung mga yan eh. Kung magrereklamo yan, ba't ang tagal-tagal ko, kanina pa ako dito. So you have to show them the reality na it's not your fault and it's their fault na maaga sila na pumunta, or it's not your fault kasi mas natagalan yung doktor. So it's the way na i-explain mo yung sitwasyon. Parang wala kang magagawa kasi parang yun nandun ka na sa point na yun. So kailangan mo na lang harapin by explaining to the patient yung totoong nangyari. Kung hindi pa rin nila maintindihan, it's out of your hand na. Ang mag-explain na susunod dyan, yung doktor. And most of the time, sa experience ko, pag doktor na nagsalita, quiet na sila. There's no difference. The only difference pala is you cannot fully understand your patient if you're in a country na hindi mo fully or hindi ka fully well-versed sa language nila. Pero same lang din yung ugali.
Tinry niyo pong mag-aral pa ng language nila.
Ay nako, syempre, mapipick up mo na din Kaya, tsaka hindi lang sa language actually, pati sa facial expressions nila. Pag nakita mo nang nagagalit sila, i-explain mo na agad. Wait lang po, kasi natagalan yung isang pasyente, susunod na kayo. Yung mga tipong ganun. O kaya, kanina tinawag kita na nung oras ng appointment mo, wala ka. It's not our fault na, so you have to wait.
When you talk about transcultural nursing, I guess it should be not on handling patients, I think, because you will always know how to handle a patient. Yung handling or isipin mo kasi kung paano ka makikitungo sa ibang staff or sa ibang nurses, doon kasi nagbabago yun. Sa tingin ko, yung pag-handle ng patients, kaya mo But the most important thing for you to know or to understand is that you know how to speak their language. That way, hindi ka mahihirapan makipag-communicate. Because given na yung pagrespeto natin sa cultural differences, say for example, hindi naman, it's a Muslim country per se, pero tapos hindi pa hindi lahat ng panahon, or there are actually exemptions to Islam when it comes to the sick. So it's totally different from what you usually would see in movies or in what you would read, I think. Wala namang difference. It's how you handle the patient and how you communicate.
Isang problema rin po yung language barrier po.
Yes, that's the number one problem, I think. Nung nasa Saudi ako, I started from zero knowledge with Arabic. I left the country with a lot of knowledge. Natutulong ako sa yung constant communication with the patients, constant communications with your doctors. Kasi mostly ng doctors naman sa Saudi are able to speak Arabic or English. So, dun ka talaga matututo. First hand. Tapos, when you go out, of course, you learn some words through other people.
In the interview that our team conducted, we conclude that the interview is number one problem in working abroad as a nurse, particularly in Saudi Arabia, is the language barrier. Our interviewees experience difficulties in understanding their patients because of the difference in language of both sides. But they overcome it by slowly learning the language on a day-to-day basis, by listening carefully to their coworkers and patients, and also by doing their best efforts to learn it. By doing this kind of adjustments and learning, they were able to care for their patients in their best possible ways as a nurse. With all that being said, our team would like to thank our interviewees, Ms. Kim Gail Andres and her brother, Mr. Carl Andrew Hernandez, and to all the nurses abroad and here in the Philippines.